Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center, reporting for the week of October 30th, 2023. After a COVID status update, I will discuss top public health challenges in addition to SARS-CoV-2. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. COVID is still with us. It's still causing sickness, disability, and death, and there's still a lot we don't know. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Today, I'm going to skip the nationwide wastewater information because I'm finding that reporting to be lagging, and also with the declining number of sites reporting, and every site that is reporting is detecting SARS-CoV-2, some going up, some going down, but no place has zero. And if you're interested specifically in wastewater, please try to find a location near you. I've linked a bunch of resources in the post, and I'll probably be back to the nationwide one, but it seems to be going through a bit of a lag or a decline in reporting right now, so it's a little frustrating. So I'm going to skip it today. And so going to case positivity, test positivity rate. So this has been coming down since the most recent peak that we had just a couple months ago in late August. We're now at 9.4% positivity as of October 14th. And that's based upon about 70,000 tests per week being conducted. So the number of tests being conducted coming down a little bit. But as we kind of head into respiratory virus season, which I'll talk about a little more in a bit, we probably would expect more tests to be being done just across the board for COVID, as well as flu and other things. But the good news is that the percent positivity continues to decline. But remember, we had gotten down to 4.1% just this past June, so we are still more than double that. But let's hope we keep heading in the right direction before things turn back around. Now, for our most updated indicator, which is the percentage of all emergency department visits with diagnosed COVID-19 in the US, this graph is showing us through October 27th. This has been coming down since the peak we had in late August, but you can see it's kind of coming down more slowly than it went up. So the slope on the right of that peak is not as steep as how we came up to the peak. And it kind of looks like we're plateauing off a little bit there, which I really do not like to see. So this is something that we're going to keep watching. And kind of similar here with hospitalizations. So these are hospitalizations for and with COVID, and they are very slowly ticking down. This is the fifth week in a row where we're kind of barely creeping down, but really that didn't change much from the week before. So coming down a lot more slowly than it went up, and we're still over 16,000 new weekly hospital admissions. This is more than double what we were seeing for most of the month of June. So this is still a lot of people every week being admitted for or with COVID. And I know I would like to see this come down a lot better than this before we head into respiratory virus season, which is really right around the corner. And taking a look at deaths, we finally stopped climbing here in terms of weekly deaths, but it is looking kind of like we're leveling off here, which is not good, in the mid 1300s of deaths every single week. So it's a very concerning place to be leveling off. I certainly hope it will continue to come down, but every week we see those gray bars, which are the preliminary, those keep getting added to, and where we seem to be landing every week is like almost the same as the week before. So really kind of watching to see and hoping that this is going to come down significantly soon. And taking a look at variant proportions, there's not a lot that has changed here in terms of this variant proportion tracker here. We still have over 99% subvariants of XBB, which is what our vaccine is tuned against, and that's all of those shown here. So that is good news. But the CDC did recently come out with this post called Variants Happen, talking about two Omicron subvariants that they are keeping an eye on, and actually reported on one of them, BA.2.86, back in August when we first were noticing it, because it has some concerning mutations and it has quite a number of them on spike protein. And so far, it hasn't taken off in terms of spreading too quickly, so that's good news. But as I mentioned then, and I'll repeat it now, one of the concerns when you have that many mutations is that it might just be one more mutation away from something that could be problematic because it's already kind of diverging far enough from the lineage that we created the booster for. And we do seem to have that scenario now with another variant called JN.1, which has one more important and concerning mutation, kind of the one that nobody wanted to see happen, on top of what the BA.2.86 has. And it was detected here in the United States in September. It's been detected since then in 11 more countries. And so far, it looks like our new vaccine booster, as well as our treatments, should be effective against both of these variants. So we'll just have to wait and see there. But I guess for me, I was actually a little bit encouraged by the fact that the CDC put out this report, because it does suggest that they are able to be, or are choosing to be, more proactive now in communicating what's going on with variants, because we know we're not going to see it on the tracker until it reaches a significant percentage. But that's not the only thing that's significant as it relates to variants. So I'm glad to see a report coming out before it's a widespread variant causing problems. And so it's good to see some proactive reporting so that we are not being caught off guard. So, just by way of reminder, several counties here in California, here in the Bay Area, are resuming mask requirements in many healthcare settings starting on November 1st. So, Santa Clara County, Alameda County, Contra Costa, Sonoma, San Mateo counties, they're all beginning mask mandates again in hospitals. There's little different nuances from one county to the next, but I think they're all underscoring the same thing, which is that we want to do what we can to mitigate spread of respiratory viruses during what is typically a high season, particularly for flu and RSV. Of course, we know COVID doesn't have a season. So I first of all really am grateful that this is happening here. I really hope other places in the country will follow suit. And as you know, if you've been watching me, I think this should be year round, since again, COVID is not seasonal and it is responsible for the most rapid spread and the most significant outbreaks. But this is definitely better than nothing, and it by design comes at a time when we're heading into the season for the other infections like flu and RSV. And as we know, the spread of all these viruses is greatly reduced with mask wearing. So, just a little bit about those other respiratory viruses. We'll be going back to looking at CDC's Flu View, which is where they post all of the flu data. And we can see here that cases, they're just starting to increase just slightly. We're very early right now. And for the week ending October 21st, we were at 1.7% positive specimens and 1,456 hospital admissions. Remember, that's, by contrast, we've had over 16,000. So 1,400 for flu, 16,000 for COVID hospital admissions in a week. And of course, we do expect the burden of flu to start increasing from here. And just to also put this in further context, here are flu deaths since 2019. We can see that from 2020 to 2021, where we were really doing a lot to mitigate the spread of COVID. Every healthcare setting had required masks. We were doing a lot of mitigating all around, and flu deaths came down to a very, very low level, like actually we have not seen before. And one of our flu strains, actually, the influenza B Yamagata strain, actually basically disappeared since then. So it remains to be seen if that's going to be totally extinct, but we haven't seen it for a while, which is kind of amazing. This past flu season, unfortunately, we did see the burden of flu go back up again. And in our worst weeks of the 2022-23 flu season. We got all the way up to 1,048 deaths in 1 week. So our very worst week of flu deaths this past winter was still not as severe as where we are right now with COVID at over 1,300 deaths every week, but it's still very significant. And so, of course, when we start to add all these things together, we have to be concerned about the overall burden of these respiratory illnesses on individuals and communities as well as the healthcare system. And here, taking a look at detections of RSV nationwide, we can see that we're starting to kind of swoop up here, just like we did about this time this last year. And I'll talk about the new RSV vaccine in a future briefing. If you're particularly someone who's high risk, if you're over 65 or over 60, something to chat with your doctor about. Also, for pregnant moms, this can prevent severe illness in newborns. And so this is definitely something to talk with your physician about. And again, I'll be reviewing this in more detail in a future briefing. But for right now, I just wanted to show that we are indeed heading into the RSV season. This is national. Again, if you look at wastewater in your own area, you may see it ticking upward. We're certainly seeing it just beginning to tick up here in Oakland as well. And you can take a look at your area if that is of interest. So it will certainly be helpful for the health of patients and people taking care of them that there will be mask wearing mandated inside of many healthcare settings here in the Bay Area in California. I hope more locations nationwide will follow suit. But it's not just healthcare settings where we should be interested in protecting ourselves and others. So it's something to really consider for yourself and loved ones if you have dropped masking or maybe gotten a little more casual about it. As temperatures get colder, people start to head inside more. The respiratory viruses all start to increase, as is predictable and predicted. This would be a good time, if you haven't been masking, to resume. And so now I want to take a moment to just kind of zoom out and think a little bit broadly about our top public health challenges. This is, of course, very subjective, but I did kind of like this article. I'm not going to say I agree with everything, but I did like this approach. This is published in Public Health Challenges. It came out in June, and they essentially talk with public health experts and other folks, and then they compare that against some of the emerging data and information to lift up what they see as the top 10 public health challenges. And they did this last year. Of course, COVID was at the top of the list. The infodemic, or the epidemic of bad information, also made the list, among a number of other things. So it is interesting. I linked the article in the post. It's an easy read. And again, we this is all subjective. Even what is considered public health is somewhat subjective. So, and then this is also taking a worldwide view. But what they list is our health system as the number one concern, followed by the mental health and substance use crises. And I think we all certainly have concerns about the status of our health systems, of our healthcare workforce, as well as the increasing burden of behavioral health and substance use challenges in our communities. Number 4 is infectious diseases. I just talked about 3 of them that are still giving us trouble, particularly COVID, but also flu, RSV. And of course, the reason why COVID is so important is not only just the sheer magnitude of illness, hospitalization, and death that we're still experiencing, but also because of how much remains unknown. And with it being so new and it being a threat and a kind of an evolving threat, this is something that we've never had a shortage of information to discuss on this weekly briefing since June 2020, as it relates to COVID. But of course, as it relates to infectious diseases, there are also a number of others that we need to keep an eye on. I'll touch on a couple of them in a moment, but certainly HIV/AIDS, sexually transmitted infections that we've discussed here before that are headed in the wrong direction, unfortunately. We just had kind of last summer a Mpox outbreak. That wasn't too long ago. Seems like we've gotten some decent control over, but it's certainly not gone. And that's certainly something we had not experienced as far as human to human sort of outbreak of that magnitude ever before. So some of these things emerging just kind of reminds us that we have to stay on our toes. And I think that there's no question that the consequences of such a high burden of COVID infection is a huge threat. So I was disappointed to not see it called out separately here. Post COVID and long COVID is already creating a massive burden. It's a mass disabling event. There is widespread concern for what this is going to mean for the health status of really of our country and of the whole world. So I was disappointed to not see this called out separately. And I think in my mind, it's included here because it is a post-infectious, essentially, sequelae that we're still trying to really wrap our arms around. We still don't have any cure. We're barely scratching the surface of understanding what all is going on with post-COVID events and with long COVID, and very minimal treatment trials in the work so far. So we feel behind, and I feel like this could have been, at the top of the list perhaps. But again, this is not something we're all going to necessarily agree about, but certainly great for kind of thinking about and discussing. But I will call out that some of our post-COVID impacts are on this list. Like we know that we're seeing neuropsychological issues. We did see some increases in substance use. We definitely are seeing increases in new onset diabetes as well as worsening control of diabetes after COVID. So diabetes made the list this year for good reason, but just kind of pointing out that some of these things are certainly being exacerbated by the COVID pandemic. And remember, this is a list about global public health. So we've got malnutrition and food insecurity. Sexual and reproductive health is certainly a global concern, has been because unfortunately we have varying degrees, but in some places too high incidence of maternal and infant challenges and mortality. And we do also have a high burden of sexually transmitted infections in many parts of the world and here in the United States. And of course, here in the United States, with the rolling back of reproductive rights that we've seen recently in some parts of the nation, we are going to need to keep an eye out for the impact of that on health outcomes, among other things. And we've got environmental pollution and climate crisis, which we know that the climate crisis appears to be contributing to some infectious diseases, which I'll touch on in a minute, and also some of the natural disasters like floods and things that we've been seeing at an increasing rate as well, which impact the public's health. And of course, cancer and diabetes here are individual health concerns, but because of the burden and because we can prevent a lot of the bad outcomes with proper education and prevention, I think that these can also be considered certainly public health challenges. And of course, one of our cancers, human papillomavirus, can actually be prevented with a vaccine. So certainly a public health issue with a very solid and safe public health intervention that is not utilized to the fullest extent, particularly in some parts of the world. So again, this is subjective. This is not only about the United States. And I would lastly add about this that I still think that the disinformation or the infodemic is still a huge threat, not only currently, but also in the event of any new pandemics, because we have seen how damaging it can be. And it has kind of created the need for this briefing and a lot of other proactive health communication because of all of the confusion that has been created. And we could do, of course, entire segments on that. But one of the fallouts has to do with vaccine confidence. So I'm just going to briefly share this report that just came out in the CDC's Morbidity and Mortality Weekly Report on October 27th. And this is really just, a little bit of an update. And this is also looking globally. And this time we're looking at routine vaccination coverage. And I don't think we have any surprise here that We know that especially in the beginning of the pandemic, we really were set back in terms of childhood immunization programs all across the world, including here in the United States. And I think this one is kind of a good news, bad news thing where things got pretty low there in 2020 and 2021. But what they found was from 2021 to 2022, we're coming back a little bit, but we're still not where we were pre-pandemic. So the examples they provided here were DTP, or the diphtheria, tetanus, pertussis vaccine, as well as the measles vaccine. And we saw a dip worldwide from 19 to 20, and then it seems to be headed up, but we're just not even back to where we were in 2019 when we still had a lot of work left to do. So the bottom line here is that we've got a lot of work ahead of us to get our children caught up, not only obviously for the individual health of each and every one of our children, but also so that we do not find ourselves facing outbreaks of things that we were previously on track to eradicate or at least control. We do not want to head back to a pre-vaccine era. That is just completely unnecessary, and I think it's something that we need to take seriously. And lastly, I reported earlier this year about locally acquired malaria. I've linked that briefing in the post in case you're interested. But in short, this summer we had some locally acquired cases of malaria in Texas and Florida. And this is pretty jarring because before that, the last time we had any locally acquired malaria was 2 decades ago in 2003. So even though cases are definitely still low overall, as far as locally acquired in the United States, this does mean that there are mosquitoes here in the US, at least in some regions in the US, that are transmitting malaria. And we know that malaria is serious and potentially fatal. So this is certainly concerning. And the thinking behind why this is happening has to do with a lot of factors, but one of them is the climate crisis that is making conditions more hospitable for these mosquitoes. And there are some other factors like how well our pesticides might be working or not. But it really is difficult to control mosquitoes. And in fact, mosquitoes are said to kill over 1 million people every year because they can not only transmit malaria, but also dengue and Zika virus, among others. And those can not only kill people, but also cause prolonged sicknesses and disability. And in some good news, there's actually a rather effective new malaria vaccine that has been developed and is being rolled out in parts of the world where malaria is a particularly worse problem. It's still taking the lives of particularly a lot of children. And so this is just a wonderful development. So this is good news. And there is a great, easy read that I've linked in the post. It's in The Guardian. It's an interesting read. If this is something that you are interested in, take a look. So in summary, we are kind of having a leveling off of COVID at a place that frankly feels uncomfortable to be leveling off at, with over 16,000 hospitalizations a week, over 1,300 deaths a week. And I think we have an expectation that cases will go up this winter, as they have every winter. I think we can still be hopeful that if we can get vaccines and treatments, especially to those at greater risk of poor outcomes, and we can get it to them in a timely fashion, I'm hoping that those increases in cases don't have to result in big increases in hospitalizations and deaths. But that is not guaranteed. If we're not being proactive, then cases will lead to more hospitalization and death. So I cannot say this enough. If you are someone who should be treated, if you catch COVID, then you should know that in advance, and you should have a testing plan, a treatment plan, and a caregiving plan in place. Here are the available outpatient treatments. And now, with commercialization of the pandemic response came a lot of changes into how you might be accessing things related to COVID. But you absolutely have the right to be treated to prevent you from being one of those 16,000 plus being hospitalized and 1,300 plus dying every week. It might not be easy to get treatment. It might take some real coordination, especially if for any reason you're unable to take the first line treatment, which is Paxlovid, because some of the next options are IV. They're not as accessible. They're going to take coordination with your doctor. But if you're truly someone who's at risk of a severe outcome, this is something that needs to be worked out in advance. I can tell you that all this coordination and legwork is not fun if you're sick. So please do it now. COVID is still with us. It's still causing sickness, disability, and death, and there is still a lot we don't know. And the season for for some of the other respiratory viruses like influenza and RSV is upon us. And flu is also something that can be treated if it's caught early, if you're somebody who's at high risk of a bad outcome. And of course, we've got the flu vaccine. It's effective in preventing severe outcomes. So that is recommended for everyone, but especially those at the extremes of age or those with underlying conditions. The RSV vaccine, again, we'll talk about more in a future briefing, but that may also be a consideration. And remember that the mitigations and best practices that we use for SARS-CoV-2 are effective, maybe even more effective for flu and RSV, simply because those respiratory viruses are, well, they're spread, in the same way, but they're not quite as contagious as COVID. So if you're stopping COVID, you are very likely stopping RSV and flu, which is really what we actually literally saw during times of the pandemic where we were doing more mitigating. So let's keep up our best practices to prevent the spread of all respiratory illnesses and prevent outbreaks. Remember that no one layer is foolproof, so we want to implement layers of protection. Stay up to date on vaccination. Get that monovalent booster if you haven't gotten it yet. Wear a high quality filtration mask like an N95, KN95, or KF94, especially indoors with others. Whenever possible, gather outside. Outdoors is almost always safer than indoors. If you must gather indoors, consider pre-event testing. Also, do what you can to monitor and improve indoor ventilation and filtration. Remember, even if you've had COVID once, it's better not to get it a second time. If you had it twice, avoid a third time, and so on. There is mounting evidence of cumulative effects of repeat infection, and there doesn't seem to be any limit to the number of times you can get COVID. If you don't feel well, please stay home and rest. Get tested so you can make an appropriate plan to not spread what you've got to others. And if you do come up positive, please test negative before you go back around others. In general, when it comes to our antigen tests, enough virus to detect is enough to infect. If you don't have a primary care provider, please get one. Know how to reach them before you need them. Remember to eat a balanced diet, incorporate fruits and vegetables, whole grains, and avoid sugary drinks. Consider a multivitamin supplement. Get some regular physical activity. Unless you're sick, then please get your rest. Get your blood pressure and your baseline labs checked, like sugar and cholesterol, vitamin D. Manage your stress levels and get a good night's sleep. We will be off next week because Roots Community Health Center observes Black Solidarity Day the Monday before Election Day to remind us of our collective strength and political and economic power. Black Solidarity Day was established in 1969 as a collective call to action of people of the African diaspora to abstain from work, school, and commercial activities and to instead focus on upliftment of our own institutions and community. Black Solidarity Day is observed in many cities across the country, as well as institutions of higher learning, including many HBCUs. This year, Black Solidarity Day falls on Monday, November 6th. So as a result, we will not have a briefing on November 7th, but we will be celebrating for the remainder of the week. I encourage you to follow us on social media at Roots Empowers to join us for activities of upliftment and economic empowerment and multiple opportunities to show your solidarity. And we will be back on November 14th. Look forward to seeing you then.